Hello, I'm Terry Georgiou from the London Psychology Collective. Today we have with us Professor Emmy van Deurzen, who is one of the UK's best-known figures in the field of existential psychotherapy. Emmy is a philosopher, a psychotherapist, a psychologist, and a university professor. She is also an author on many books on existential psychotherapy. Welcome, Emmy.
Hi there.
So would you like to start, Emmy, by telling us what existential psychotherapy is?
Existential therapy, in a nutshell, is a philosophical method of working with people to help them resolve their difficulties in living.
Okay, that sounds like a very
Short and sharp,
succinct
yes.
explanation. And before we go into more detail, I'd also like to ask about existential coaching as well.
Okay, so existential coaching is a way to help people who have troubles, specific issues, usually in their work, to get a more philosophical perspective on those, and therefore to be able to be in a position to make more wise decisions. And those decisions could be about their personal lives, about the way they do their job, but they could also be decisions in their organizations or in their enterprise, or they could be political decisions as well. So coaching can apply to lots of different settings where psychotherapy and counselling would not be appropriate and undesirable.
And so both of these areas are, I suppose, influenced by similar figures,
Very much so,
writers
yes.
and
The
thinkers
same.
and psychologists
Yeah.
and philosophers, of course.
Absolutely.
So could you tell us about some of the key figures that have influenced you?
Yes. Well, in terms of the existential bit of the therapy, it's the philosophers that are more important to me than the therapists, because there really haven't been that many therapists who have worked with truly existential methods up to the recent years. So the philosophers that influenced me the most, the one that's got to come first is Socrates, and that's Socrates rather than Plato, but Plato as well. But it is the figure of Socrates and his approach of truth-finding, argumentation, dialogue with people together to find out what is really the case about something that's influenced me more than anything else. But then other philosophers like Aristotle as well, and obviously Stoical philosophers and other Athenian philosophers too. And then in the later period there is a philosopher that influenced me greatly, who is Spinoza, who is a Portuguese/Dutch philosopher, who had a fantastic system of philosophy, which was a systematic philosophy where he really understood how human existence is put together, and I found that fascinating. Then of course there are other people like Hegel or Kant, but after that it's really the existential philosophers that have profoundly influenced me. Kierkegaard, Nietzsche, Husserl, Jaspers, Heidegger, Sartre, Merleau-Ponty, Camus, Simone de Beauvoir, and then a whole range of more recent people, including Ricoeur as well. And then, of course, my own teacher, Michel Henry, who is more and more well known now and who was a great phenomenologist, who taught me really how to do proper phenomenology. I'm very grateful for that.
Well, yeah.
Therapist-wise, like everybody, Freud, of course, did influence me a lot. And I actually think he was a bit of a phenomenologist. You may or you may not know that he and Husserl were at the same lectures by Franz Brentano. And it's really Franz Brentano who invented phenomenology. So Freud and Husserl lived at very similar times and were both influenced by that way of thinking. So Freud's ideas have been quite instrumental in getting me engaged in psychotherapy and psychoanalysis, obviously. But I was quite influenced by Ludwig Binswanger, because in France he was the only real known existential therapist, and I was taught Ludwig Binswanger's case studies very early on, so he affected me quite a lot. Jasper's work affected me too, and a guy called Henri A., who is a French psychiatrist who created a whole system of psychopathology along phenomenological lines, so they influenced me. And then as I started working myself as an existential therapist, I discovered the work of R.D. Laing and read that very avidly, and that influenced me very deeply because it encouraged me to find another way of working. I mean, he obviously talked about the theory of how we could think differently about mental illness, but he didn't really come up with a method. And so I was very aware that there was a gap, and from very early on I wanted to close that gap.
Yeah. And could you tell us briefly a little bit about phenomenology?
Phenomenology, very briefly presumably, is it was set up by Edmund Husserl, who was a mathematician and a logician, and who came to realize that the mathematical methods were not sufficient for the social sciences and for the psychological sciences. He also became aware that really psychology is an essential part of our observations in all the other sciences, and that therefore we needed a method that could include the values of science whilst also being adequate to deal with a person's experience and a person's connection with the world. So phenomenology has a series of methods which help you describe and get to the bottom of a phenomenon that you observe in the world. And in helping you to get to understand what that phenomenon is really about, you will also see how that phenomenon is in connection not only to yourself and your consciousness, but also how it connects to all the things around it. So it gives you a whole picture of how things fit together in the world, which you can't ever do with the scientific method that was established, previously, because that's always a specialization and is always based on analysis of a very small part of the world.
Yeah.
So it was an essential addition.
So phenomenology is one of the concepts that emerged from reading these texts, learning from these thinkers, these writers.
Yeah.
What are some of the other concepts, do you think, that have emerged through all of that reading and that have influenced the work that you do?
Well, the concept of being in relation with another person. So the work of people like Max Scheler and Martin Buber have also been very important to me. And indeed Paul Tillich and Jaspers, who have all spoken about the importance of rethinking the way we relate to other people, and who have all questioned the idea that there is a separate self and that we can just kind of create a relationship, and have rather highlighted the idea that we're always in relation, and that therefore the way in which we do that relating is crucial to the way in which we would do psychotherapy as well. So that's influenced me majorly, and I have experimented over the years with different ways of relating to other people and of being in the world really altogether. And I think that's been very important to freeing myself from the kind of normally accepted norms around how to do psychotherapy, and made it much more experimental.
And I suppose in your approach to existential therapy, there are some of the concepts that have been highlighted by some of those existential philosophers, some of those earlier philosophers.
Yeah.
Which concepts do you think are used kind of regularly in your approach?
Yeah, well, my sort of method of structural existential analysis is very much based on the four worlds as Heidegger has described them, and well, the fourfold. That was his expression, and also von Uexküll and Binswanger developing the idea that we actually operate at different levels, and that if you look at different species, you will find they live in a different world, that depending on how your consciousness is organized, how your brain is organized, you tune into the world in very different ways. And therefore it is very important to be systematic in your observations of what the world seems like to another person, and not to assume that you already know. So very often other people create meaning from a different standpoint and a different worldview than you do yourself. And so you have to have a method to figure out where they're coming from, and a method to dilute your own worldview, and to kind of be open to a different way of seeing things. But also, of course, coming to them in a dialogue so that they can see that there are other ways of looking at the same issues, and therefore learn. Which is why I like group psychotherapy very much. Because what happens when you do group psychotherapy is that you have many different standpoints. So that's the perfect place for practicing phenomenology. Everybody comes from their point of view, and when you share those points of view, all of you get a much broader view, a much wider view, and a much deeper view. And therefore, your experience changes.
So one of the aspects you're saying is important here is helping people understand what their worldview is, and allowing it to be challenged. That can happen in group therapy, and it can happen in individual therapy, that they can examine what is their view of the world and themselves, and That's it. But of course that also means that as the therapist you need to be prepared to get in there and to expose some of your own takes on things, and to be aware that you're biased about things. That you can never be this so-called unbiased neutral therapist, or this phenomenologist who sets aside their bias. There's no such thing. And it's not what Husserl intended. Husserl intended us to be aware of our own point of view and our own bias, and to bring it into the equation, but to see how we bring it in. Because your bias is your edge. It is the kind of point from which you approach the world, and you have to use it. My particular background and experience is here today as I speak to you, and I can't pretend it isn't. Well, I could, but I'd become very robotic and very switched off. And that is not, I think, the purpose of human relationships. The opposite is true. It's about us being open to each other's experience and each other's riches and each other's wealth of information and understanding, and put it together so that we create a much bigger understanding. And so with each of my clients, my understanding changes and it grows. And so it's quite compelling as a process, that every time I really open to another person, my own life is elucidated in a new way. Yeah. So this is the idea that the therapist can allow themselves to be changed by the encounter. So every time you have a new client, you're saying that you won't keep an objective or your own subjective view and stick to it rigidly. Yes. You'll see that there's a difference in the way the client sees the world. You'll try to enter that world and allow yourself to be changed to some degree.
Yes. I think this is one of the ways in which you can verify whether you're doing the work properly. Are you stuck, to your own position, or are you really immersed in the therapy sufficiently for you to be learning something new? If I'm not moved, if I'm not touched, if I'm not challenged, if I'm not changing, if I'm not feeling that something is altered, I know I'm not working properly. When I feel that is happening, that something is diluted, that something between us comes together, and that out of that new things are emerging which are good for that other person, which make that other person suddenly feel that life is possible again. Life is good again. There are new discoveries to be had. There are new corners to turn. There are new discoveries to make. New things will happen. Life will bring them. If I just open myself to it, life will bring change for the better. When that starts to happen, I know I'm on the right track.
And in terms of existential therapy, when people speak about it, what often comes to mind is the idea that it's something about also facing the idea that we're all eventually all going to die at some point.
Thank you for bringing that in. I was quite forgetting about that.
Okay,
Yeah.
so because I think people sometimes get confused as well. Maybe you can help us understand, why would it be important to think about death or the end of life?
It's really about setting your own living experience against the background of time going by, and to become aware of the flow of life that happens as time ticks away. So it's not so much about your death when you're 92, it's about how you're dying now in the moment. But as you're dying now in the moment, you're also coming to life again. So there is a process of transformation. Because when you become alert to this, you realize that something is flowing through you that is not stagnant and that is not set in stone, but that is fluid, that is flexible, that is open, and that means that anything is possible. That to make things impossible or difficult requires you to pretend that things do not change and that there is a self which is set in stone and which will remain the same, hard and unchangeable. So to be open to the flow of time is usually a good way into being open to the flow of your own life, and to become aware of how precious that is, and how you can either choose to deny that or run away from it, or to engage with it and to really make it count and make it matter.
So the idea that we've got this lens that we look through where we're thinking of time and thinking of that time will end, in a sense focuses us on the importance of living fully now.
To live, to be alert, to be engaged, yes.
Yeah.
And that's not just about living now, lest people believe that I'm preaching about the here and now. Far from it, because it is about being alert to all the rich experiences from the past, and to not let those just be in the past, but to claim them and to use them and to learn from them. Now, every day I go back over past experiences, and every day my past changes. It's like, there's a new bit of the puzzle falling into place again. I hadn't seen that yet. Actually, that happened to me and I thought of it this way, but I can also think of it this way and this way and this way. And so all of your past experience are like jewels that you can polish up and that shine new lights in your present. And the same is true for the future. Your future can be just some kind of dark, unknown something that you're more or less cut off from. Or it can be this kind of openness where there's so many paths you can take and so many projects you can follow or put yourself into. And to think about that and to think about which way to turn and to stay open to that changes it again. So time in all those ways is important.
And these concepts that we're talking about sound quite different to some of the concepts that might be focused on in other therapy approaches. I'm thinking of recent approaches like cognitive behavioural therapy, which is really popular at the moment, and how there's a very different emphasis there. But I was wondering what your view was on how existential therapy relates or contrasts with these recent approaches.
Yes. Well, CBT is a very pragmatic approach. and it is very specific. So it teaches people to do some very specific things about the way in which they think about the world. It's quite cognitively and behaviorally based, obviously. So that narrows the focus of what you look at in therapy, and that can be very helpful if you want to do a small job of therapy, a specific job, a fairly short-term job. But it's not enough if you want to help a person to really approach the bigger questions of life and to have a much bigger exploration of what they want their lives to be about, what they want to become, what they want to do with the time allotted to them. Those kinds of deeper questions require a different method and a different kind of openness. And I think CBT is aware of that too. So if you look at the third wave of CBT with mindfulness and those kinds of methods coming in, there is already a move in that direction to make up for that lack of breadth and that lack of depth. But I actually think it doesn't really matter what we call a therapy, as long as we take these kinds of philosophical dimensions into account and we're willing to be with the person rather than to dictate or prescribe to the person, then it's okay, I'm easy, Not everybody does have to be an existential therapist. But I think everybody needs to be aware that people's issues are very rarely about these pragmatic problems. They are usually about some big thing that's gone wrong in their life, and that's usually because they are confused about who they are, what life is about, what death is about, what their beliefs are, what their values are. So as long as you don't address those, I don't think you're doing much of a job.
And so just to round up, I wanted to ask you, for those people that are not having existential therapy, is there a way that they can access some of these ideas and apply some of the existential themes to their daily lives?
Absolutely. I'm a great believer in that. I think I will do this horrible thing of writing popular books before too long for a wider public.
Well, we'll look forward to that.
Because I actually think that is crucial. If you wait for a person to go wrong and to get lost and get confused and to acquire pathology, it's a bit too late, really. This should be happening around education, in schools, in families. It should happen to ordinary people. They should have an opportunity to benefit from what we know about how to live one's life, what happens if you do this, or what happens if you do that, how you can look at things in a different way, and how you can bring things to life for yourself. It's essential. It's amazing to me that we don't teach people these things, and whenever I have a chance to do so, I find people are incredibly greedy for it, at all ages. So, little kids, they're great natural philosophers. Teenagers, the teenage angst is an essential moment, is a threshold moment where the person thinks, my God, who am I going to be? What is all this about? How can I possibly find my way around this world? Highly anxiety provoking. We leave them to it. No, why? Why not provide them with the resources? Help them think, help them feel, help them be with other people in different ways. Yeah. Same is true at mid-age, same is true in old age, working with dying people. Even if they haven't had that privilege of knowing those things throughout their lives, they often have a moment where it's vitally important to them to make sense of what they've done and what they haven't done, and to have a chance to round it up, bring it together, and find meaning in it.
Yeah, I think people of all ages, as you said, could really benefit from this, and I think there's a real thirst at the moment for psychological and philosophical ideas in people's everyday lives, and people are reading more and there are more books published, so we'll look forward to anything you publish in the future, especially on the popular front.
Thank you very much, I'm working on it.
Well, it's been a great pleasure having you here, Emmy. Thank you very much.
Good. Thank you. I've enjoyed it. Thank you.